Hello? Yes, umefika. Nani uko Ima? Acha nimcall. Okay. Ima, niaje nipe nini? 10cc 10cc syringes. Nipe 30. Alafu nini na nguo ilikuja? Hii B complex. Nipe 3. Nipe 3 sawa. Nipe hizo. Nifide pin pack moja mnauzaje? Nipe moja pia. Nipe hiyo Nefi. Mpe mwekee receipt nita. Guys, some technical issues, guys. You know, electronics sometimes they can fail you. You're just doing your stuff and then something pops up. So I'm sorry about that technical issue that has happened. It was a problem, I think, by the internet connection. The internet connection, and so sorry about that. I will check on it. I think there is a problem with the wires, especially when it is at times like this. You will not. Okay. So we continue with the topic. Let's just like whatever we have as we continue. We continue with the topic. We had started and we had discussed about how the blood flows on a child's heart. How the blood flows on the child heart, and we say it from the liver of the mother through the umbilical veins. It comes to the right atrium, passes through a hole here, a hole that is called patent foramen oval. Then it comes down here. It comes down here to the right ventricle, and then it pushes. Hilda Taylor, welcome to the platform. We had Dr. Moni. How are you doing? Yes, everything is okay. Yes, Hilda Taylor, thanks for your coming. Everything is okay. We had started, but I had a technical itch, so I've just reset everything again. We are talking about congenital heart defects that children are born with. So in the heart, right now I'm just giving a review of what can a review of how blood flows in a child's heart. From the umbilical veins, they come from the umbilical veins, they come to the right atrium, then flows through a hole here that is called foramen oval. Then to the left atrium, from the left atrium, it goes to the left ventricle, and then it is pushed through something called patent ductus arteriosus. And then it goes to systemic circulation. So we had started and we had said, if you are coming in again, so sorry about that technical hit. Sometimes you understand some connections and some connections can let you down. You understand? So for now, what we can do is we can recap, just get a recap of what we have done and what we had gone through. We had started and said that what causes heart defects. Let's get a recap. What causes heart defects? We had said there are some things that makes you to get heart defects. Like we had said there are some things that can make you to have heart defects, like genetic factors. Down syndrome is a genetic factor, you understand. It is called trisomy 21. Maternal infection, e.g. rubella. If you have not, this is another video, guys. If you have not liked, just like this one. The other one had a technical issues and it went. And then we have maternal conditions like diabetes and alcohol. diabetes and alcohol. Sometimes when you are pregnant and some women are diabetic, it can cause some congenital problems. And then we have something called alcohol. When you are drinking and you are pregnant, it can cause a mutation during the formation of the baby. So it may form some mutations. Okay, we continue. We continue. We have several conditions like the certain medications used in pregnancy. Medications used in pregnancy. Yes, like we gave an example of valproate, those that are used in epilepsy. You see, those are medications that can make you have these conditions. Heart, a baby can be born with these heart conditions. So we have some other conditions that we get which are so bad, and the causes are unknown of the heart, but mostly they are linked to conditions that are CHDs too. So we can say that we have said how the fetal blood flows around your heart, but you know, blood flows from the left side to the right side. Nosis, cyanosis. Oh, you see, after we have known the causes, please, if you have not liked the video, just like this video. We had started so well and then we got a technical hitch. After the technical hitch, I had to start again. So I'm sorry about that complication that we have gone through. For those that have waited, thank you so much. Thank you so much for your patience. Thank you so much for your patience. Now, there are some children who are born with congenital heart anomalies. You see, CHDs are those conditions, we call them CHDs, congenital heart defects, problems that babies are born with of the heart. Now, we will go and see which types of problems that the babies are born with of the heart. Let's get and see which are the problems. We have a classification. Let's see, classification. The classification, hope it will not give us, yes, like that. Classifications, let's write here. Classifications. Classifications. Let's classify. Let's classify. We are so many guys. Let's increase the likes. Let's go on liking so that the people that went can come back. You know, sometimes you people can when you like, it tells someone that I'm online. So if let's like so that people can know we are online. And in classification we have a cyanotic classification. A cyanotic a cyanotic classification. This one is when blood flows from the left side to the right side. Blood is flowing from the left side to the right side. A baby is born but has a problem whereby blood is flowing from the left side to the right side instead of flowing from the right side, going the normal way to the lungs and then comes back to the left side. No cyanosis. In this complication, when you hear anything about a cyanotic, you should know that when you hear anything about a cyanotic, you should know that a cyanotic means there is no lack of oxygen, because the blood that comes from the left is coming from the lungs, so it is oxygenated. So we have conditions like atrioseptal defects, hole between the atria. We have conditions like atrioseptal atrioseptal from the atrioseptal. Atrioseptal means that, hope everyone is listening. There's been an hitch. If you are hearing my voice clearly, please tell me. The complication has made some, even the systems in the hospital are jumping up, but it's being created. The technicians are upon it. So let's talk about atrioseptal conditions. Atrioseptal conditions. What are atrioseptal conditions? Don't fail to like the video, guys. If you had liked earlier, please like this video as we continue. Please like this video as we continue with the talk. Yes, like, so that some people can come in and we continue with the discussion. Now, atrioseptal means there is a hole between the atria, the hole between the atria, a hole between the left atrium and the right atrium. A baby is born with a hole between the left atrium and the right atrium. That is atrioseptal defect. That is number one. And then we have, this is one, and then we have another one whereby it is called ventricular septal. Ventricular septal, ventricles. Ventricular septal. Ventricular septal. Ventricular septal means there is a hole between the ventricles. That one was atrioseptal. This one is ventricles. There is a hole here. Here, a child is born with a hole between the heart here, between here. It is called ventricular septal defect. Ventricular septal hole between the ventricles. And then we have patent ductus arteriosus. Patent ductus arteriosus. This one, patent ductus patent ductus arteriosus. Patent ductus arteriosus. Now, you remember how the blood was flowing along the child's heart. The way I was explaining how it comes to the foramen oval, then it goes to, you remember that? That is a very, when the child is in the womb, the child is in the womb, that is a normal flow. But you see, when the child has come out of the yes. Slow. Anakuja kumexamine. That is normal. That is normal. Yes. Thanks a lot, Tilda Taylor. Thanks a lot. Now, that is a normal circulation when a baby is in the womb. But this one, when a baby is born, it is called a congenital defect because the hole does not close. Normally, it closes within 24 to 48 hours. You get it? It closes between 24 to 48 hours after birth. A normal fetus blood vessel connecting the pulmonary artery to the aorta. So it is between the pulmonary to the aorta. Patent, you remember how blood comes and then it joins here so that it can go systemic, how we talked how the blood flows. So it is when within 24 hours to 2 weeks, that hole has not yet closed. We call it a congenital heart defect because of what? That hole has not closed. So it is a problem because most of the blood will be flowing through that hole and this child will have some congenital heart defect. So we continue, that is another problem, patent ductus arteriosus. And then we have coarctation of aorta. Coarctation, anytime you hear about coarctation, Just know I'm meaning narrowing of the outer. Hmm? Narrowing of the outer. So the complications of the blood of the heart, whereby complications of the heart, whereby there is a dummy that please guys, let's like the video, or it's me who is not seeing the likes. Let me see. Is me who is not seeing the likes or what? Seems there is a technical hitch up with you with there is a technical hitch up with YouTube. Some things are not working correctly. Let me see if there is a dummy of the heart so that we can learn how those vessels. I hope it is not being used right now. Let me get it. Don't go away. Just a minute, and then I come. Please, just a minute, and then I come. Stay put a minute, second, even not a minute. Yes. Sorry about that. It's being used by some students. So let's just continue. So coarctation of outer is narrowing of the blood vessels, and we want to know what can cause them. Effects. What are the effects of these problems? Acyanotic. Acyanotic means cyanosis means lack of lack of lack of oxygen, lack of oxygen. So when you say acyanotic, it means you have oxygen. Acyanotic, those that don't have less oxygen, those that don't have less oxygen. So let's check this out. Let's check this out. Let's check this out. Atrioseptal atrioseptal defect, atriums, ventricular septal defect. People, we had in La Taylor, we had started before. We had started before, and there was a problem with network. I think that they are confused on which link to press. Let me communicate somewhere so that those people can know. We had started, and then we had a technical hitch. So let me connect. Let me connect some people. Connect some people. Let me connect. Just give me a second. I connect with some people because we had started, and then we got the link was bad, and then we had to restart. We had to restart. Let me connect with some people. Sorry about the technical hitch. Those who are watching, sorry about the technical hitch. Okay. Just give me a second. I tell the guys that were in that you are back in another link so that they can come back to they can come back and continue. It's not good for a person to miss a topic like this one. Some of them are very interested in this topic. Just a minute, I communicate. Communicate, communicate to I communicate. Just a minute, I communicate to people who are interested and Let me communicate so that they can come. I think I can call some of them. There is someone who told me that he doesn't want to miss this topic on congenital heart defect. Okay, I think Judy is in the platform. Judy, are you here? Are you around? If you're not around, let me call you. Let me call you. Okay, I think I have that number. Let me tell people that there was a problem. I think there was a problem with the network, and then I had to restart. I had to restart the I had to restart the topic. Hey, Judy. Oh, sorry, I had a network issue, but it's being resolved. So nimeingia na another link. You've seen it, eh? Or I've posted it in the admins group. Uh, Now that's it. People had not known that I had another link, so it's good to notify people that I'm here. Now we continue. We continue with the topic. I think I've posted it in the admins group, and there are some people who are coming in. Let me see. Jamaican uncle had a problem with the battery. Jamaican uncle had a problem with the battery. Now let's continue. Now let's go on with the talk. Let's go on with the talk. And now we are saying atrioseptal defects. Atrioseptal defects. Atrioseptal defects are defects from the atrium, a hole in the that is between the atrium and the right. And this one mostly is, there are two types of holes. There is one called foramen ovale, and there is the other one which is called patent ductus arteriosus, which is between the outer and the pulmonary artery. The outer and the pulmonary artery. So these holes, when you are born and you have them, you see, they increase pulmonary blood flow. They increase there is what they do, because if someone may ask me this question, if this blood that is coming from the right atrium is not affecting anything, this blood that is coming from the right atrium is not causing any problem, and oxygen is rich, we can just leave the holes as they are. We can just leave the holes as they are. But I'll say this, it is a risk. It is a risk because this is, it is called, there is an amount of blood that is needed to go to the lungs. You get it? So if these holes are there, you get it? Like the one that I've said, the one that I've said, they do what? They have some problems. Let's review. Atrioseptal defects, ventricular defects, having a hole between the septal. Septal is this one, this layer that is separating the left and the right atria. Patent ductus arteriosus. You get it? Patent ductus arteriosus. The hole that communicates. These are the effects. These ones. You get these ones. These ones. These ones are the problem. And then we have coarctation of the outer. Coarctation of the outer. This one, coarctation of the outer means constriction of this, constriction of this outer. It becomes small. It becomes smaller. You get it? So we have several complications here. There are 1, 2, 3, 4. These complications that I'm naming here, these complications that I'm naming here, it means that the blood is coming in, but the problem is it has oxygen. The problem is it is causing pressure to the blood that is flowing to the lungs, to the blood that is flowing to the lungs. You get it? The problem is that it's a bigger problem. It increases, when I say it increases pulmonary blood flow, it means it is increasing the flow of blood to the lungs. It is increasing the flow of blood to the lungs. And what may happen? We may get risk of heart failure. Heart failure over time. Because now we have holes. Instead of blood going through the normal way, blessings to you. Sorry, Jamaican uncle, it was a technical hitch and now we are back. Thank you for understanding. Thank you for coming back. Thank you so much for coming back. It is nice that you are here. Sorry about that. You see these problems that I've named: atrioseptal, ventricular, patent ductus, atresiosus, and coarctation of the aorta. It is blood coming to the heart from the left, but it has oxygen. So a question that someone may put is, if blood is coming to the lungs and it has oxygen and a person is living well, why should we be concerned about it? My friends, we should be, Judy, thanks for coming in. Oh, I've called you and I realized I had to call you, but it's okay, Judy. I'll call you and we discuss some issues. Sorry about that technical glitch. So I was saying, someone may say that if blood is coming from the lungs and it is coming to the left side of the heart and it has oxygen and this person is living a good life, why should we be concerned? It is a matter of concern, because if the heart is coming from, the blood is coming from the lungs, and you have a hole like atrioseptal, the septum from the atriums have a hole, it is causing massive blood that is mixing of blood that is deoxygenated and oxygenated. So the blood that is going to the body, first of all, it is not getting enough. Mercy Grace, hello, welcome to the chat. Blood that is going to the system, it is not getting enough of oxygen that is needed. You see that? It is very important to note that, because if you don't get enough blood, it's mixing with the deoxygenated blood. Blood does not have oxygen. What will happen? What will happen is the coefficient, the amount of blood that will go to the body will be the amount of blood, red blood cells that have enough oxygen will be low. If the amount of red blood cells that are going to the system is going and it's low, you see this person will always be dizzy with no energy. You get it? Those are the complications that we have noted right now, complications that are cyanotic. When you hear cyanotic, it means no oxygen. When you hear cyanotic, it means no oxygen. But when you hear acyanotic, it means with oxygen. Let me write this in. Acyanotic. You get it? It means, Benjamin, what is the topic? I just joined. Oh, Savior Man. We are talking about those heart conditions that babies are born with. Okay, people are coming in right now. Thanks for joining in, everyone. Thanks for joining. We had a technical hitch up, but now it is corrected. And now let me explain. Let me further explain before we go on, because so that people can understand. The normal blood flow of a baby, this was a question from Jamaican uncle one day. I know people will remember it. The normal flow of a baby's blood. If you are joining, please give the video a like. Please give the video a like. Is from the umbilical blood flow. From the umbilical blood flows to the right vena cava. You see, we have superior and inferior. I'm saying this is a normal blood flow. And then it comes to the right atrium. From the right atrium, blood jumps to the left atrium through a hole here through morning Ridley, through a hole here called foramen oval. From the foramen oval, it comes to the right. This is how the flow of blood of a baby is. Comes to the left ventricle, and then when it goes back to the pulmonary and it artery, and it goes to the through a hole here again called patent ductus arteriosus, and it goes now to the system. But there are heart conditions that are the babies, you get it? That is a flow from umbilical veins to the atrium through a hole here, goes to the left atrium here, then goes directly through a flow from the pulmonary atrium. It bypasses the light, it doesn't come here, so it goes directly to the atrium. But today we are learning about heart conditions that babies are born with. They are called congenital anomalies. Ridley, welcome to the platform. Good morning. Morning where you are. Morning. It's a good day for everyone. And you see we are discussing Johnny Be Good. Happy Easter, everyone. Johnny Be Good. Thank you for tuning in. Thank you for tuning in. And I see you all. You are good. Don't forget to like and share to a friend of yours this topic. So we have the classification of conditions. Now, today we have classified them in different ways. In different ways, we have classified them in different ways. In these ways, we have classified in these ways. We have started. Uncle, good morning. I hope all is well with yourself. Blessings for your family. Yes, Uncle is well. If you are joining, please don't leave without giving a like, and stay put so that we can like. We have classification. So we have classified them according to a cyanotic. Those that you have issues, but your blood has oxygen. Your blood has oxygen. You get it? You have the issues, but your blood has oxygen. So the ones that the conditions that the blood has oxygen, I think Saviaman, you are following. Those that blood, these are the conditions that are called as cyanotic. The blood has oxygen. So from the left, so there is some atrioseptal. Atrioseptal, we have said a hole from the right atrium to the left atrium. That is foramen oval that is not closed. And then we have ventricular septal, a hole through the septum of the heart. So it is mixing blood from the left ventricle to the right ventricle. And then we have patent ductus arteriosus. You remember our arteriosus here that takes blood to the outer to the system did not close. And then we have coarctation of the outer, which is constriction of this vein, the vein that takes blood to the system. It is becoming constricted, smaller. Those are the problems. Now, we are still classifying them, and then we have those that are called cyanotic. We have those that are called cyanotic. So what are the cyanotic ones? What are the cyanotic ones? We have those that are called cyanotic. Cyanotic, it means cyanotic. Cyanotic, it means that these ones, your blood has no oxygen. They have no oxygen. There is a condition that is very famous, and I know some of you have known about it. It is called tetralogy of Fallot. What is tetralogy of Fallot? This is the major condition that makes you have oxygen that has no blood that has no oxygen in your system. Blood that has no oxygen to your system when you are a baby and you are born. It consists of 4 complications. It consists of 4 complications, and the 4 complications are ventricular septal defect. Ventricular septal defect, a hole between the ventricles. One, this is a syndrome of several things. One is called, let's write, ventricular septal defect. Ventricular septal defect. What is ventricular septal defect? Your heart as a whole between the ventricles. The other thing that your heart has under this is second is pulmonary stenosis. Pulmonary stenosis. What is pulmonary stenosis? Pulmonary stenosis. When we say stenosis means narrowing. Chacharas, welcome to the platform, Chacharas. I can see, is it your first time here? Welcome and learn. Please don't leave without liking. Give a like to this. Pulmonary stenosis means this artery is narrowed. It is narrow. Imagine the same heart has this. It has a hole between the septum. The heart has a hole between the septum here, and then this artery is constricted. The artery is small. The artery is small. Pulmonary stenosis. The artery is small. And then we have another thing. You want to be a doctor, very well, like this channel, follow every inch of this channel. And if you have time, make me a call so that we discuss and I give you tips. Okay, we have said pulmonary stenosis. Hopefully he's not busy and comes by. Okay, yes. Right ventricular. And then we have another feature. Thanks a lot. Thanks a lot. Another feature is right ventricular hypertrophy. Right? Hypertrophy. Now that you have a hole in the heart, most of the blood is coming to the right side. It means that this side of the heart will be bigger. This is called tetralogy of Fallot. You have a hole in the heart, you have pulmonary constriction, this vein is smaller, and then you have right ventricular hypertrophy, but we have what? Because tetralogy means four. Tetra means four. So we have another feature here called, the last one, it is called overriding aorta. Overriding aorta. What is overriding aorta? This aorta, instead of coming here, this one is here and this one is here, and then they are twisted. Overriding aorta. So tetralogy of Fallot is one main thing that makes people have deoxygenated blood. It is a very bad condition. When overriding aorta, this aorta comes here and this one here, it means that this one will be picking deoxygenated blood going to the body, and this one, when it comes, you get low oxygen, because now from the system you get oxygen, and this one, the one that is supposed to take oxygen is the one that is supposed to take blood to the system is now the pulmonary artery. So it takes, Benjamin, do you have cardiovascular hospital expand where it can? Benjamin, do you cardiovascular hospital expand everywhere in Kenya? That's what I'm trying to create right now. And there are some, but I'm trying to create a cardiovascular and heart conditions hospital. I think I'll make it. I'm trying hard to do that, Savior man. I'm trying so hard to do that with all those. It's not a walk in the park. It is, you need some more equipment and some certification from the boards of our country. So that is my try. I'm trying hard to do that. Now, when you hear, have you ever heard about something called blue baby syndrome? Blue baby syndrome. Blue baby syndrome is because, you see, let me explain it so softly and slowly. So softly and slowly. It means that the pulmonary artery is the one which is taking blood to the system because it's overriding the aorta. So you check when blood is coming from the lungs, coming from the left atrium, it comes down and it comes here. So oxygenated blood is mixing with deoxygenated blood. Blood with oxygen. Please, if you have not liked the topic, like the video. When you like, it tells people someone is doing good job. Let's go and see. Please like, don't just watch. Please like, and let's tell people we do hear some things that are good. Listen, this one. The first one we dealt with as cyanotic. These ones are the conditions that you have. Yes, Uncle will be greetings to everyone. I'll be doing StreamYard at 12 p.m. Georgia time. Thanks again. Uncle will be doing StreamYard. So you can join Uncle live and the people will see you talking to Jamaican Uncle at 12 p.m. Georgia time. Let me see. What is 12 p.m.? Let me take a break a bit. At 12 p.m. Georgia time in my time. So if you want to talk to Jamaican Uncle as people see you and interact through StreamYard, this one, if you want to talk to Jamaican Uncle and stream, and people, oh, it will be 7. It will be 7 in Nairobi. So people that are in Nairobi, at 7, you can meet Jamaican Uncle. You can meet Jamaican Uncle and talk to him live, directly as people see you on Streamline. Okay, so we continue. I was saying, a cyanotic. We started by classification. The classifications are maybe a bit, just a minute. So the classification of heart diseases that people are born with are 2 types. We have classified them as cyanotic, classification. A cyanotic. Now, I want to write down the classification so that we can understand. Classification we have classified as cyanotic and cyanotic. We have classified them under two classification order, and these 2 classification, Benjamin, people in Africa need to be treated equally in terms of emergency treatment, having money or not. A lot of people are losing their lives because of lack of money. That's what they need. Yes, Savior man. You know, medical treatment is a very expensive affair. Drugs are expensive, and running a medical facility is expensive. So it needs a good heart to understand that they need to be treated equally. So the funds that people have, they are not enough. They are not enough. So you get that people struggle to go to hospitals. I wish I had the funds to do that faster, but I'm working on it. And I think some things will have changed. So don't worry. When it is coming up, in a new hospital, I'll be vlogging it, and you will see. I'll see how I can help the people, because ask even uncle. Uncle knows. Jamaican uncle knows. Sometimes I go overboard to do some things. I will not talk about them here. Savior man, that is a point you have, but I'll talk about it. There is a topic that will come that is called HSM, Health System Management, and you will learn how to run medical system and how it is very complicated. Now, if you have not liked, please give me that like. Let's continue and classify. We start by classifying. Cyanotic means blood that has oxygen. Cyanotic means blood that has no oxygen. So the effects, the ones, this is the classification. We have two types of congenital heart defects, two types of classifications that a baby is born with. A baby is born with this. A baby is born with these two, classified under conditions that gives everyone need to be treated emergency camp to save life instead of chasing money. It pained me a lot. Health system in Africa, you help a lot of people behind the scene. Uncle, I wish Savior Man could understand. Tell Savior Man my life. I think you can explain to Savior Life about my life, but it's okay. I will not say it publicly here. Let's just learn, and then we will talk about this when it will come to health system management. All this, Savior Man, I want you to be there that day. I'll send you a link so that you can understand how it is hard. Now, classifications. Cyanotic. Now, for those that are cyanotic, they have oxygen in their blood. Cyanotic, they have oxygen in their blood, and we have classified them under atrioseptal defects. Atrium, septal. Septal means a hole. So atrioseptal defect is a hole between the right and the left atrium. Ventricular septal, a hole between the ventricles. This septum as a whole. And then we have patent ductus arteriosus. That when the child was born, our hole that is here, pulmonary artery and the aorta, the one that pushes blood to the system, did not close. So it is still open. And then we saw the other one that is last. We saw the coarctation of the aorta. Coarctation of the aorta is this one. The aorta is constricted. Those are four types of problems that you can born with. And then we have seen another complication, cyanotic, that you were born with, which is called tetralogy of Fallot. So when you talk about tetra, those are four complications. And these four complications, what have we seen? We have seen, one, this person as a whole through the septum. Two, this person has overriding aortas. This one has exchange has come here, and this one has come here. And then, you see, it is called tetralogy of Fallot. Pulmonary stenosis. It has pulmonary stenosis. This one, pulmonary artery that takes the blood to the lungs, is constricted. It is small. So the blood that goes to your lungs is very minimal. It takes a lot of, so minimal. You see, and remember, if it is minimal, this one is swelling because it cannot pass enough blood to go. You get it? It cannot pass the blood to go. Those are cyanotic problems that people, if you have a question, guys, let's ask any question that we have. So we continue and say that what is the problem when it comes to tetralogy of Fallot? Tetralogy of Fallot. This one that a person has no enough oxygen because oxygen is mixing, is here cooking dinner early. Thanks a lot. Oxygen, the oxygen, oxygenated blood is mixing with the deoxygenated blood. Remember, this one, aorta, is taking deoxygenated blood and it's taking deoxygenated blood to the body. And then the pulmonary artery is still taking blood from the left atrium going back to the lungs. So blood is mixing up. All blood is mixing up. Blood is mixing up. Deoxygenated blood is mixing up with oxygenated blood. You see, this is a very bad condition that a baby is born with. You get it? We call it blue baby syndrome because if the pulmonary artery, as you can see it, is taking little blood to the lungs. It means that what you are having is blood with no oxygen that is coming to your body. And blood with no oxygen that is coming to your body means what? You become blue, because deoxygenated, when the red blood cell is red, it means red and bright red. It means what? It means that the cells are gaining oxygen and they are red. But when they are blue, it means they are not oxygenated. So you become bluish under your, if you check the baby's arms, they are blue. The soles of the feet are blue. The eyes are blue. You get it. Others, there are some others that are cyanotic, that are not tetralogy of Fallot. You see, tetralogy of Fallot is a heart that have all those. There is like transposition of the great arteries, of great artery. These arteries have transposed. That one I've explained how they have transposed. Tricuspid arteries. Tricuspid atresia. Tricuspid atresia here. Tricuspid valve. Where is it? Here. It is small. Blood is not passing on well, or there is a problem with the tricuspid valve. You know, when you have a problem with the valve, blood will not pass in the how it is needed. So we call it, it's a serious congenital defect where the tricuspid valves do not form. You see, atresia, it's not there. They are small, or it's not there. This passage, it's not there. So blocking blood to flow to the atriums. You get it? To the right atrium, to the atrium, to the ventricle. Here, blood comes here, but it does not come here. Or very minimal blood comes to the right ventricle. So the blood that goes to the lungs to be oxygenated is very minimal. And then we have someone called TAPAV, total anomalous pulmonary venous return. Just imagine, blood that is supposed to go to the lungs, it is not going as needed. It's coming back. It is called TAPAV. Those ones are conditions that you can get, and then you get what? Blue syndrome. Blue syndrome. Benjamin, in Kenya, the babies who are born with disabilities, how do the government support them? Any Kenyan in the chat, please, let me not answer that question. Any Kenyan who is in the chat, please answer Savior Man. I don't want to get political, Savior Man, because this is a learning process. I just want anyone who is in the chat who is a Kenyan to answer you that question, and then I'll add if I can add. You get it? It is it's not good when I go political. What we can do sometimes is we try to help where we can. You see, total anomalous pulmonary venous return is a serious condition, a heart condition, where all pulmonary veins do not connect to the atria as they should. If pulmonary veins are not connecting to the atria, we have here pulmonary vein, we have pulmonary artery. You see, you will not get enough oxygen, and the flow of blood to your heart will be depreciated. So you'll be having blue syndrome. TAPAV is a very bad condition which needs urgent surgery to connect those valves where they should be connected. Total anomalous pulmonary vein return. Because pulmonary vein bring oxygenated blood to the right atrium. And you see, it may not be connected there. It can be connected to the right atrium. So it will be bringing oxygenated blood to the right atrium. Those are conditions that we fight. So Signs and symptoms. What can make you know that your child has these problems? If you have a question, now we are going to the time where we can answer a question. Now, if anyone who is watching and you are in Kenya, anyone who is watching and you are in Kenya, there are some questions here that Savior Man is asking. Please help me to answer them. If you are watching and you are in Kenya, check out those questions that Savior Man is asking, like the one that he has asked, the last one. Okay. Now, signs and symptoms. You see your baby with bluish lips and skin, bluish lips and skin. Difficulty in feeding. Difficulty in feeding. Welcome, Christine Long. Welcome so much. We are learning about conditions of the heart that a baby are born with. I know you have come late, but we have had some technical issues here and there. Please, you will rewatch and then you can help a mother somewhere or a family somewhere. Now, we have cyanosis, which is the bluish syndrome we have talked about, cyanosis on the lips and the skins, and then we have difficulty in breathing because he's not getting enough blood. We have poor weight gain because if you don't have enough oxygen, metabolism is slow, so you don't have weight gain. Rapid breathing, your heart beats so faster so that at least the oxygen that you've got can go through the head and you can. If you have any question, please ask. There is one that I've put pending. I don't know if is there anyone in Kenya who is watching? Please, if you are in Kenya and watching and listening to me, please help me answer that question. Help me answer that question that Savior Man has asked. Help me answer that question that Savior Man has asked. Benjamin, in Kenya, let me read it. Benjamin, in Kenya, the babies who born with disabilities, how the government support them. Please, if you are in Kenya and you are watching me, this is a question that you can answer. Please help me to answer that. I don't want to get so political. Okay. Let's go to rapid breathing and excessive sweating always. But if a child has, mostly the children that are born with cyanotic, they live long. They live long, so they get older, and then they are always having easy fatigability. They get easy fatigability. They get shortness of breath. They get shortness of breath, and again frequent chest infections. Dudes, blessings, Benjamin, the wise guy. Thanks, Dudes page for coming. Even if you are coming late, I know you will rewatch. And please don't leave without giving me a like. A like is a good one. Happy Easter. Everything you see, Kenyans have. I cannot answer that question. Savior Man, when people are silent and cannot answer that question, just know there is a problem. You get it? There is a pro. Let's not talk about it so much. I will talk about it when I'm doing a topic called health service management system. Please, let's not talk about it. Now, we have the older children, they are always having easy fatigability, shortness of breath, and frequent chest complications. Because no oxygen, no good care of immunity, you get always chest complications. Then complications, we have heart failure, because now if the right side and the pulmonary, you've seen there are some cases where the pulmonary vein is constricted, you will have pulmonary hypertension. The flow of blood to the lungs will have a problem. Infective endocarditis, infections, that is an infection. Arrhythmias, the heart beating always bad, or not in order. Anyone who has a question on today's topic, please give me a question on today's topic. But don't forget that tonight, Jamaican Uncle is meeting people live, one-on-one. Jamaican Uncle is meeting people one-on-one. So if you want to talk with Jamaican Uncle while seeing him and other people are seeing you and Jamaican Uncle, tune in. at 12 Georgia time, but in Kenya it will be at 7 in the evening PM. At Georgia time it will be, Benjamin, heart failure isn't a joke. Yes, heart failure is not a joke. But you see, these are things that children are born with. These are things that children are born with. So when they are born with them, we need to do some surgeries and we need to know how to take care of them. Hmm? So, what can a mother, as we continue to finish now, we are at the finish line. What can a mother do? What can a mother do? What can a mother do to do what? Not to give birth to babies with CHDs. Eh? What can you do as a mother? As I finish, this is the last topic. If you have a question, it's your time to ask. If you have your question, it's your time to ask a question, any question that you have. Yes, a Jamaican uncle probably is doing that. Johnny Be Good probably is doing that. If you have a question, please don't fail to ask. Ask that question. Let's help each other. Preventing congenital heart defects isn't always possible at times. Eh? Some happen due to genetic and unknown causes. I will start by saying that. But many risks can be significant. Many risks can be significant. To get it. Now, we will. If I want to take this prevention to, what do you think? Can we take this prevention to Jamaican uncle is in the kitchen, to the next topic tomorrow, or can I get questions from you? What do you think, guys, in the chat? I think we should take this topic of prevention to the next, as we start the next topic, because I think people are still in vacation and we don't want to take most of the people's time. Mostly here in Kenya, I've said Easter is a time where people are celebrating, eh? Are celebrating like Christmas. So we have dealt with congenital heart defects today, and the other thing we'll deal with is how to prevent CHDs, because this one is got when a child is in the womb. So treatment is only after birth if you've got it. So anyone with any question, I'm sorry about the technical hitch today. I'm so sorry about the technical hitch today. We started and then Wi-Fi decided to tell us we cannot continue. So I had to come up with another link. So if you have come today late, please do what? Always help me by rewatching and sharing this video. We will talk about how to prevent these complications, tomorrow. Everyone, remember at 7, if you want to talk to directly to Jamaican uncle, if you want Jamaican uncle to interact live, to talk to him, to interact, to talk to the people, he'll be live. That is how many minutes from now? In Kenya, it's 45 minutes from now. Yes, Benjamin, true. People in Africa celebrate Easter like Christmas, eating good food and drinking soda and beer. Yes, Xavier, man. But you see, most of them, we call it family time. Easter holidays in Kenya, most of them are family time. This is whereby the people in go to your mother's place at home, you meet all of you brothers and you interact. So now most of the people have traveled, and as you've seen, from Friday, even me, I've been home. I've been home with the family doing my things. You've seen? Yes. So guys, I think there is no more questions. There is no more questions. Let's meet tomorrow. Or is there anyone with a question that I'm leaving behind? If you have any question, please ask. If you have any question, please ask. Ask any question that you may like. But you've seen, Xavier man, the question that you've asked, no one has no one has replied to it. So it means there is a problem. It means there is a problem, and that problem only God can sort it. Only God can sort it. So we have already 1 hour. Today we are so excited that we'll be joining Jamaican Uncle live. Remember our topic that we have talked about is topic of the day has been issues concerning children that are born with heart defects, and we have categorized them as cyanotic and acyanotic. So we will talk about how to manage or how to prevent. We will talk about, it's a big, management is big. So we will talk about the management in terms of how to prevent, and how to manage them tomorrow. That is how we will manage them. So what's the time? 6:17. Let me give 2 minutes. 2 minutes. If there is anyone who thinks he has a question, 2 minutes. If there is anyone who thinks have a question, can ask. As Jamaican uncle is preparing his live. Jamaican uncle is preparing his live. Will go live. I can see some people are coming when it is question time. If you are coming in now, please. It's good you give a like. Give a like even if you are coming late. Give a like. Don't fail to give a like. You're like something else at Christine Law. I see at greetings to all. I see uh, uh, the Wi-Fi complication brought some Benjamin, have you reached out to Juiceman about his herbal product? Xavier man, I want to meet Juiceman face to face because sorry I was a bit late. It's okay. It's okay, Christian Law, because whatever the Jewish man was talking about on the video of Jamaican uncle, you may realize it's what we have been discussing at complementary medicine. So I'll plan with Jamaican uncle on how to reach the Jewish man, and we discussed with the Jewish man about, because I realized that guy has so many things that he knows that are medical. Hmm? And you see, when Savior man, that is very important question that you've asked. When I talked about complementary medicine, I said there are herbal medicine that are adapted with the conventional medicine. Conventional medicine means the products of the hospital that we use, medical, oral, and intravenous. So when this Jewish man was talking, I realized he knows most of the physiology. Jewish man knows some things that are in complementary medicine. And you remember when we talked about complementary medicine, we said the complementary medicine is adapted from experience and outcome. And the people that have come and adapted the same tactic and art from the forefathers. And it is not laboratory oriented, it is experience and results. So our forefathers may have learned so many things. Please, if you have not gone through our talk on complementary medicine, the playlist is long. Go and learn about herbal medicines. Go and learn about herbal medicines in the complementary medicine uh, uh, chart. It is very, you will see that the Jewish man was talking what I was talking about. And that is what made me feel like I should meet the Jewish man. I should meet the Jewish man one of these fine days. We talk one on one because I can have some experience, and also he may have an input in more of my research. He may have an input in more of my research. So I know Jamaican uncle will link up with that and we will meet one day. We will see. And I know he, the Jewish man, is going through my work at the complementary medicine. So Savior man, no worries. One day you will see me live with the Jewish man. Very soon, because when it comes to these issues of yes, Jewish man gave us the number live on camera. I have it, and even if I could not, he could not give us. Jamaican uncle will give me. I will reach out to it. One day I'll make that link up. Yes, that is very important. Xavier man. Xavier man is a technical thinker and a practical thinker. He knows the best and he knows what to do and what not to do. Mm. We will see that. So I think there are so many messages, but people are not asking them. So if you have a message, please link up with me. We see how we can help each other. Link up with me. We see how we can help each other. Anyone with any question? I'm still waiting for questions, and the people are not asking any question. The people in the chat ain't asking any question. It's only Savior Man who is being asking questions. And let's ask any question that you have. One day I'll make a link up. Yes, Uncle. Uncle, please do make it link up. Let's see how we can continue my research with the Jewish man so that we can grow together. You see? And I see he has herbs that, even he was talking of some herbs that are in Africa and others are not in Africa. I want to research on those herbs that are not in Africa. Mhm. So, guys, as you prepare everything that you're doing, as you do, those that have come late, I know you rewatch. You rewatch this as two segments. You start from the first that brought problems, and then you link up on this. So, have a nice day. Enjoy your Easter with family, and let's meet what time? At Jamaican Uncle's time, 12 Georgia time, 7 East African time. Bye. Enjoy your day. Thanks for being calm and waiting for me. Bye bye. See you later.